After the state of California approved Medi-Cal, that's California's Medicaid program, they approved it for anybody, regardless of their immigration status. Who knew that millions of people would sign up and it would become wildly prohibitive from a financial standpoint, to the point where California now faces a $6.2 billion Medi-Cal meltdown? Let's get into it. Here we go.
Governor Gavin Newsom signed a bill today that, among other things, plugs an unexpected budget gap to fund Medi-Cal through late June. The low-income healthcare program serves more than a third of the state's 39 million people, and its expansion to include undocumented immigrants has been pretty controversial. ABC 10's Becca Hobbecker breaks down the change tonight.
When state lawmakers passed the budget for this current fiscal year, which runs July of 2024 through the end of this June, they underestimated just how much the low-income healthcare program Medi-Cal would cost. That's California's Medicaid, funded with state and federal dollars. 15 million of California's 39 million people, more than a third, get their healthcare from Medi-Cal.
So 15 million.
Are getting that coverage.
Chris McKaylee is an adjunct professor with University of the Pacific's McGeorge School of Law. He says because Medi-Cal is costing more than the state budgeted this fiscal year, Governor Gavin Newsom borrowed $3.4 billion from the general fund last month. He also asked lawmakers to allocate an additional $2.8 billion from the general fund just to keep the program afloat through the end of June. Lawmakers did that on Thursday by passing AB 100.
Of course they did.
Budget Bill Jr., which
keep spending
the current budget. Newsom signed it Monday. It goes into effect immediately and unlocks matching federal Medicaid dollars. So why is Medi-Cal over budget?
So according to the Department of Finance, we've seen a big increase in the cost of providing medical services.
Okay. All right.
The cost of pharmaceuticals and other medicines. But we've also seen a substantial increase in the number of individuals covered who are undocumented.
There you go.
Starting in
There you go.
California
Oops.
expanded Medi-Cal eligibility to include all low-income undocumented immigrants. Republican state lawmakers pushed back against AB 100, saying, in part, this spending bill throws nearly $3 billion towards benefits for illegal immigrants with zero accountability for how costs got so out of control.
Zero.
Newsom has defended Medi-Cal's expansion, saying that making preventive care accessible to all low-income people helps save the state money in the long run. As for Medi-Cal's funding this next...
I keep hearing that. I keep hearing that as an argument. I'd love to see the stats on that. Okay. I mean, maybe, but that's aside from the fact you have just basically given billions of dollars, and now you're giving taxpayers federal dollars. You're giving federal dollars, everybody, not just Californians' money, to the illegals, the criminal illegal aliens who you have welcomed into your state. You're a sanctuary state, sanctuary status. All right, we're gonna give you medical coverage as well. Who doesn't want free medical coverage? Build it and they will come, right? Well, these are the repercussions of build it and they will come. Oh, good Lord, they all came and they've all got medical coverage now and we're paying for it. We're on the hook. What do we do? Well, let's borrow from here. We'll borrow from here. We'll get some Fed dollars in here. Just keep going.
Fiscal year, plus paying back that $3.4 billion general fund loan.
The budget negotiations that will begin in earnest in middle of May through June the 15th, which is the deadline, that's when they'll determine how much more money is required for funding the Medi-Cal program.
More.
Through next June 30th.
More.
100 addressed more than just Medi-Cal funding. The bill also includes money for wildfire prevention and continued recovery efforts in the wake of the Southern California wildfires from earlier this year.
Of course it does. They tagged it.
That will add $170 million in funding to prioritize wildfire prevention, clearing brush, thinning forests, building fire breaks.
Kind of a day late, dollar short on that, don't you think, Gavin? You already had the big fires. Everything's all burned up.
$171 million are going to 6 conservancies, including the California Tahoe Conservancy, for that wildfire prevention.
That is coming from Prop 4, the so-called climate bond that voters adopted at last November's ballot.
Also also authorizes the State Department of Finance to offset property tax revenue lost by the municipalities affected in the Southern California wildfires. In Sacramento, Becca Habiger, ABC 10.
So this is one of those storylines where Republicans on the front end said, basically, this is a terrible idea. Here's why. Boop, 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 and boop. And yet we just marched forward with it. I mean, California as in we just march forward with it. It's going to be great. It's going to save money in the long haul. But you've got a budget today. That's the crazy thing about all these Democrat-run programs. You've got a budget today. You got to cut expenses. And yet you're holding on to these programs that cost more. It's like, all right, we need to be saving money, not spending more money. And that's essentially what giving the illegals, giving access to this program, that's what it's done. Billions and billions of extra dollars that California doesn't have that now they're leveraging into, well, let's get the federal taxpayers on board with this. Let's get some money in from them. Just a year after launching a historic initiative to provide health care to all low-income adults, regardless of immigration status, the expansion, while hailed as a progressive milestone, oh, I bet it was. Everybody's getting free health care now. Yeah, but who's going to pay for it? Can't be bothered with that. It's proven significantly more expensive than anticipated. What? A progressive milestone that's costing more than they originally thought? I don't believe that for a second. Forcing the state to consider cost-cutting measures and reevaluate its long-term commitments. How about you just don't sign up for these knucklehead programs in the first part? What about that? What about, oh no, we've got to have these progressive milestones. Progressive milestones, that's the word of the day. The coverage expansion, which extended full Medi-Cal belt benefits to adults aged 26 to 49 without a legal immigration status, added to previous efforts that began in 2015. So many programs in California are just ill-conceived. And that's how you get just layer after layer after layer of laws and just constriction in general because of all of this legislature and programs and don't do this, can't do that, and taxation and just basically government overreach. The state had projected around 700,000 people would enroll, but underestimated how many would sign up. How do you underestimate that many? The miscalculation has contributed to a $2.7 billion overspend, exacerbated by a $540 million increase in pharmacy costs. Okay, all right, not exclusively California's fault, but you probably knew that was coming. You got that, and $1.1 billion from unexpected enrollment trends, particularly among older residents. Okay, so you got a whole bunch of old people signing up for free healthcare because now they're eligible for it? Huh, shocker. Wow, didn't see that one coming. That just right past me, right? Now, you can see these trends up front, and that's why you've got politicians that basically up front say, yeah, don't do it, and then they do it, and then they're left with, holding the bag of, oh, we told you so. How are we going to get us out of this one? To meet its financial obligations in March, the Newsom administration borrowed $3.44 billion, got another $2.8 in state funding, which gets matching. So you get $2.8 billion federal dollars, unlocking matched federal dollars. Still, officials have warned the situation is unsustainable. Keep hearing that, don't we? Yeah, to all this policy and ridiculous spending. Compounding the challenge is the looming threat from Congress, where Republican lawmakers are proposing steep Medicaid cuts that could jeopardize care for millions in California. Yep, because you basically handed it out to all of your own constituents first. All right, okay. And then you added in the whole illegal component, which some would say, you know what? When they get citizenship, let them apply then. You know what I mean? Because we don't even know if these folks are going to be able to become citizens. So many of these people that have come across the southern border illegally, they don't qualify for citizenship. They don't qualify for asylum. And yet you got California just handing out money. Oh, it's going to save them in the long term. They might not even be here in the long term. So handing out money just, hand over fist to people that aren't paying into the system. Tristan, take out that last statement. It just doesn't make a ton of sense, right? With over a third of the state's 39 million residents reliant on Medi-Cal, any reduction in federal funding would leave the state with difficult options: reduce coverage, limit enrollment, or raise taxes. What do you think's going to happen? Reduce coverage, have a bunch of people screaming at you, limit enrollment. Oh, that's not going to look. What are you guys doing? And then raise taxes. Oh, we're going right to the raise taxes. Taxes through the roof, as if they aren't already. As if they aren't already. One of my friends is down in Texas right now looking at housing. Yep. From Seattle, looking at housing in Austin. It sent me a text and he said he filled up his gas tank on his car rental for $5.99, halfway. I think it was a Camry is what he said. That's because you don't have absolutely ridiculous, mindless taxes loading up purchases like gasoline. You don't have a program, and that's what we have in the state of Washington, this carbon offset tax. Just absurd. Just absurd. Now we got really expensive gas. Same thing in California. You got really expensive gas because, we got to have, our own blend of gasoline and we can only make it here. And we're going to have to, bring in gas from the outside. Then we're also going to have to, we're going to really ratchet down on the distilleries and make sure that they have these, huge reserves. We're just basically going to micromanage the gasoline environment in California. And who knew that would lead to really expensive gas prices? You got Washington, you got California, you got Hawaii. Some of the most expensive gas prices in the United States. I mean, those are the three most, I think. Governor Gavin Newsom has defended the expansion, arguing in a recent podcast, yes, Gavin Newsom, podcasting, not really working on all the other stuff, as you can see. I mean, he's got, billion-dollar gaps that he's trying to fill, but yeah, he's off podcasting, arguing in a recent podcast that preventative care for low-income residents ultimately saves money. Maybe, but how about don't hand it out in the first place? What about that? What about that? Oh, we can't have that, Sean. You need to tax and spend. Get on board with reality. However, his administration is now weighing cost-saving strategies for the upcoming fiscal year. Guys, we're hosed here. Guys and girls, we're hosed here. What do? Let's tax California residents some more, including ending pandemic era protections that temporarily block disenrollment from Medi-Cal. Let me read that again. Ending pandemic era protections, that temporarily blocked disenrollment from Medi-Cal. I don't even understand what that is. Who knows? We're just gonna go right past it. While Newsom has insisted scaling back coverage is not on my docket, other Democratic leaders have acknowledged hard decisions are ahead. Okay. Yeah, I bet they are. I mean, it's got to come from somewhere. I said, let's just give them a big old taxation because I live in Washington and we've got similar problems here. We're going to get taxed up the behind as well. Senate President Pro Tem Mike McGuire and Assembly Speaker Robert Rivas have both vowed to protect immigrant benefits, but concede that trade-offs may be necessary. The lack of logic here, right? We're just going to keep spending. Yeah, we might have to do something long term because we agree this is unsustainable. But let's just go ahead and keep doing it. We'll throw in some kind of tax. And then we'll say it's for, it's climate control. That's what we're doing. A lot of climate control. We just got climate control going all over here, all over. The shortfall has sparked renewed criticism from Republican lawmakers. Really? I didn't see that one coming. Assembly GOP leader James Gallagher accused Democrats of poor planning and called for an audit of Medi-Cal. 100%. Let's take a little peek-see with our binoculars. Let's get over that microscope and look down and see what's going on. I think every sanctuary state should have an outside version of Doge come in and just take a look-see what all the money's going to. just in general, because it's the mindset. If you're a sanctuary state, all right, let's have you open up your books and we're going to do a financial audit. We're going to do just a real thorough audit of what you got going on, and we'll just see what the results are, right? We owe it to Californians and to the vulnerable people who depend on this program to make sure Medi-Cal is meeting their needs. Well, how about taking care of the state residents first, the legal ones, the ones that are actually residents of the state, and then working on others beyond that, depending on how the budget allows. That's what's called a budget. But all these governments, all they do is they just borrow from one thing, borrow from another, and then eventually we need some federal dollars, we need some Fed money. Even with the state's massive $322 billion budget, California officials say they lack the capacity to replace lost federal support, especially since federal funding doesn't cover preventative care for undocumented immigrants. Now, that last little sentence there, that's kind of a zinger. Preventative care for undocumented immigrants. So you got standard, ridiculous spending with no real foresight to looking at a budget indicating, all right, we got this amount of money coming in. Who knew what we're going to blow it out with? Cost overran. Weird. And then we handed it out to way more people than we thought because way more people jumped on board than we had anticipated. You know damn well they had an idea of how many folks were going to come on board. When you give away free, this is literally what I talk about all the time. If you build it, they will come. And then they come in droves. And then you wonder, and I'm talking about just population in general to California. Why wouldn't you go there? Why wouldn't you go to Portland, Oregon if you're homeless? Why wouldn't you go to Seattle, Washington if you're homeless and you love drugs and you love stealing? Why wouldn't you go to these places based on that criteria? California? It's got all of these programs, all of this spending, and it's just not sustainable. And it is, you're seeing the cracks in the infrastructure as we speak, and you've been seeing them for decades. And this is just one more thing. It's one more example of not being fiscally responsible, being socially virtue signaling. We're providing, this is groundbreaking, progressive coverage. This is so groundbreaking that we're literally losing billions of dollars in the process of doing so. But hey, let's pat ourselves on the back. We did a really good thing. Yeah, we're going to have all other states in the United States chip in with some funding here, but we've done a good thing. We've done a good thing instead of actually following a budget. Yeah. It's weird how that works, right? This is just one more example of that kind of thing. We're seeing it happen just over and over and over and over. There's always a bailout. There's always it's outside of our control. And you're like, no, you didn't have to make this choice, getting into it. You could have said, no, we're going to keep it the same. Got to be a state resident to qualify, period. How about that? Now let's come up with some other logic. We'll just keep going because we want a virtue signal. It's the greatest thing ever. And they've done that to wild progressive applause, right? Golf clap. Makes no sense to me, but I also don't live in California. I live in Washington. So I've got a whole other set of ridiculous spending initiatives to rail on. Make sure you're subscribed, hit that notification bell, all that good stuff, and I'll see you on the next one. Thanks for being here. Bye for now.